my name is Demi. I'll be the student nurse that's working with you today. Can you tell me your name and date of birth? Good, I see that on there. You don't have any allergies, correct? Good. How are you feeling today? Yeah. Are you having any pain in your IV at all? Good. And I was in here before, but I still don't see any redness or swelling or anything, so that's good. I'm glad. I'm just going to take a look. So we have normal saline running, and I checked, and that is compatible with the ceftriaxone. I see your drip chamber is half full. Tracing my tubing. We're lit up. We have our rate. Our correct channel is selected. I'm going to keep tracing our tubing. Good, we're at the correct IV site. All right, so because we're compatible, I don't have to do anything special, so we'll go through this and then I'll tell you what I would have to do if I was incompatible at all. So I'm going to start by alcoholing off for 15 seconds. Okay, 15 seconds has passed. While that dries, I'm just going to go over my medication. Has our patient's name on here. We're giving 2,000 milligrams and 20 milliliters of ceftriaxone. This was drawn up at 0900, and it's about 0910, so I'll make sure to document that once I'm done. I'm going to go ahead. I'm going to attach it. And this can be given over 1 to 4 minutes, and because I'm giving 20 milliliters, I'll be giving about 5 milliliters every 30 seconds. I can break that down even more and give 2.5 milliliters every 15 seconds. But for this, we're going to be doing the pinch-push technique. So we're pinching just to make sure we don't have too much pressure building up, too much fluid going in, things like that. I'm going to pinch and push at the same time. Pushing my 5 milliliters. Everything feeling okay? Good. Still feeling okay? So then after my 30 seconds has passed and my 5 milliliters are in, I'm going to release. Then I'm going to pinch again and push my 5. Everything still feeling okay? Good. I know you've had this before and you haven't had a reaction, so that's good. Okay, I'm going to release, then pinch again, push. Just let me know if you're having any pain or anything. I'm going to release. And I'm going to pinch again and keep pushing. Still hanging in there? Good. Okay, 30 seconds has passed. I'm going to go ahead and disconnect my med. I'm going to alcohol off for 15 seconds. Releasing friction. "15 seconds has passed. I'm gonna go ahead and open my saline flush. Like that. Flushing 2 milliliters. Good. I'm gonna alcohol off again. Seconds. Okay. So then I would make sure that I'm documenting that. And then I'm just going to talk through what would happen if my IV push medication was incompatible with my infusion medication. So one thing I could do is I could pause the infusion, remove this, and put a swab cap on and hang it up here. Then I would make sure that I'm labeling that it's intermittent tubing and then it's only good for 24 hours. And after 24 hours, it just needs to be tossed out. And then making sure that we're flushing with 10 milliliters of saline before we're reconnecting our tubing, and flushing with 10 milliliters of saline before we start our IV push. Then my next option would be pause my infusion and clamp it. And then, just for extra safety, pinching it. And then I would alcohol flush with 10 milliliters of saline, making sure that it's all getting out, all of my incompatible drug is getting out. Then I would do my IV push medication, and then alcoholing again, then doing 10 milliliters of saline, making sure that everything that's incompatible is out. And then I could release, unclamp, and restart my infusion, and that way none of the drugs that are incompatible are touching.